Well, a couple of the procedures that are often considered is neck liposuction, which is contouring of the neck strictly with the fatty layer, versus some form of a neck lift, where generally we're involving, tightening of the skin. The next layer down is the fatty layer, also called the submental fat pad. And then, of course, the deeper structures, which are the platysma muscle. It's the muscles that horses use to shake flies off their neck. I've never seen a human able to do that, but what happens is, of course, that muscle which runs from your jawline right down onto your neck, what often forms those chicken neck or turkey gobbler bands, sometimes people refer to as you age, and it's dropped down and it sort of hangs down, so it often needs to be tightened up. And occasionally we go underneath that muscle and deal with glands, we call the submaxillary glands in the neck, and other structures that are deeper that also can drop down and age the neck. So specifically with what we call submental, meaning under the chin, liposuction, so liposuction below the jawline in this neck area, that's usually reserved for a younger patient, and it's sort of the definition of younger is probably somebody under 50, but certainly 40s and early 50s may be okay, but younger patients generally have better skin. And when you do liposuction in this area, you're reducing the volume of the tissue underneath. So you're asking the skin to contract to the new shape. So if the skin is older and not very elastic, it may hang, which is not a good thing, because then you're trading fullness for looseness, which is not a good look. So generally, the liposuction alone under the chin, again, submental liposuction, is really intended for a younger patient with a heavy neck. And it's one of my favorite operations because it's a tiny little incision that you go in with a very fine cannula and you aspirate out the fat cells in that between the skin and the muscle and contour the neck to the new shape with virtually no scar. There's a tiny little incision underneath here. Then the neck lift itself is usually in an older patient, and again somebody over 50, where not only might there be fullness in the fatty layer, but then there's maybe looseness in the skin as well as drooping down on the muscles and those other structures. So all of that needs to be dealt with in the sense of a neck lift.